1 out of every 3 maternal maternity deaths occurs in Nigeria. Next slide. So last year, around December 12th, for Universal Health Coverage Day, the Nigerian government and the coordinating minister for health and social welfare launched the National Health Sector Renewal Investment. The focus was on one of the 13 SWAP priorities is on RMNCAH. Next slide, please. And the highest priority is for reducing maternal mortality. Next slide, please. When the Nigerian government presented their vision on the SWAP, one of their key priorities was crashing maternal mortality. And when you look at those priorities, you see one thing is missing: family planning. Next slide, please. So we wanted to provide the evidence to show why family planning is an imperative if your goal is to reduce maternal mortality. I work at the Gumaka Institute on the Adding Up project. Essentially, the Adding It Up is a modeling tool that uses all the data that's available from a broad array of sources, including the NDHS mix, as well as global level data, to show both the need, the impact, and the cost of scaling up comprehensive sexual reproductive health services. And to that extent, we focus across the 128 lower middle income countries, including Nigeria, to present our analysis and to show why it's important to invest in family planning and maternal and neonatal health. Next slide, please. Next slide. Next slide. Next slide. Next. Perfect. So we basically took all that data and we said, okay, let's do a comparative analysis. What if we stayed within the current level of coverage? There's the same proportion of people receiving services. Then what if we scaled up only family planning or only maternal neonatal health? And at the end of the day, we said, okay, what if you combine both scaling up family planning and maternal and newborn child health? And so one of the key things that we wanted to show is what impact does it mean when you provide these services? What does that mean for maternal mortality? Next slide. So basically, we looked at the orange line, which is current level of maternal mortality. As you can see, this is the estimated annual number of deaths exceeding 80,000 a year. When you only add, next slide, please. Next. Perfect. So when you only focus on family planning, you reduce maternal mortality by 18%. When you only focus on maternal newborn health, you reduce by 72%. When you focus on both combined together, that's family planning and MNH care, you reduce by almost 80% the number of maternal mortality in Nigeria. That's averting almost 80%, achieving more than the target that Nigeria set to achieve. That's lowering maternal mortality. Now, the next slide is where you see the actual cost effectiveness of this approach. As you can see in the first slide, we looked at what it takes to increase just maternal neonatal health. So essentially, all those interventions that were outlined in crashing maternal mortality, what impact would it have and what would it cost? Here, you see that the cost per capita of only focusing on maternal newborn health is $42.17 per capita, that's per person in Nigeria. When you combine both family planning and maternal newborn health, you lower the cost to $38. So you save $2 by investing in family planning. Next slide, please. So you can see that family planning reduces your overall costs of maternal newborn health. In other words, when you reach the people who say they want family planning, you have an immense impact on reducing maternal mortality when you combine it with maternal newborn health. And that's an important factor to consider, that it's cheaper for you to scale up family planning than to only focus on maternal newborn health if you're trying to reduce maternal mortality. Next slide, please. So, in essence, in Nigeria, for every dollar that's invested in family planning, you save $2 in maternal newborn health services. That's a fairly substantial evidence to show why family planning is a great investment. In fact, it's a very cost-effective investment in reducing maternal mortality. Next slide, please. Next slide. Next. Next. Thank you, perfect. So, in other words, we thought that in having this evidence, it was important to share it. So, use it to work together with stakeholders and advocates to develop a message around why family planning is important, why joint investment in both family planning and maternal newborn health will achieve the goals that Nigeria is trying to achieve, who you need to engage to in order to get this message and this evidence across, and how this message was received in terms of investing in. And I'm going to hand it over to my colleague, Zainab Saidu, to talk a little bit more about what that process was in using evidence to advocate.
Thank you, B. So B has taken us through how we got the data, and now we just want to let you know what next, meaning the stakeholders. So just a little bit of background on how we plan to disseminate this. So started with doing a stakeholder mapping of who are the key players when it comes to advocacy or funding for maternal, newborn health, and family planning. And we mapped them into different criteria based on kind of like a RACI matrix. High impact, high interest, low impact, low interest. And then we said we also wanted to understand the data elements that were critical to this, and then the data sources. So the data elements included things like, cost data. What's the total cost required to provide comprehensive service for family planning, taken from sources like the FP blueprint. Demographic data such as what's the maternal mortality rate, what's the total fertility rate, what's the MCPR, taken from things like the NDHS 2024, and where we didn't have that data 2018. And then benefits data, so things like what is the percentage increase or decrease in maternal mortality, what is the cost savings, obviously using the AIU model. Next please, slide please. Next slide, please. And yes, basic. So this talks to how we identify the stakeholders, how we met to discuss, and then pinpoints. So this is what we came up with. Go forward at the end of the day. An advocacy brief which addresses all the stakeholders we've seen, who we had mapped out. No, next slide, please. The one with the picture in it. The ones no, that's a little bit too far. Who we had mapped out with the key decision elements we had searched for, and the data sources, putting all that together so we can have a comprehensive picture of what is the case in Nigeria, what is the requirements, and then how do we make sure that we put all these things together so that the decision makers and stakeholders for family planning, would be able to have sufficient information to make that informed decision for joint financing for family planning and maternal newborn health. So we administered this one-on-one to a number of stakeholders. Next slide, please. And you see that over about 50% of them were Is it up? The next one, please. About 50% of this stakeholders, 50% of the partners we engaged were stakeholders, and then it was split roughly between advocates and decision makers. They were all at different levels, so federal and state were the most prominent, but we also had stakeholders who worked at the local government level and at the community level, because those are also key areas where family planning services are provided and where funding is provided, especially as we take into consideration the ALGON now, where local governments will also be autonomous and will be able to provide funding for their services. The areas of work spanned across different areas. So there was advocacy, service delivery, program implementation. We also had those who worked in community and communication. Overall, across board, all the stakeholders we engaged definitely said 100%. They see family planning and maternal newborn health as being very important and strategic towards the wider health goals of Nigeria. When we looked at the compelling data points which presented to them, what were the things that they felt resonated with them most and were most critical for them to make informed decisions? The top things that came out were, what is the MCPR rate currently? What are going to be the cost savings we have? What is the financial requirement, right? Those are the things they really wanted to see in terms of what are the reductions in maternal mortality? What are those numbers that would help them make informed decisions when it comes to funding for family planning and maternal newborn health? We took it a step further by asking, we have all this great data. What is the best way to get this communicated across board, right? And the things that came out most were having national and state meetings. An overwhelming percentage of that, over 80%, said that was a great idea. Something that also came into bear was now social media and digital platforms. So how are we now leveraging these to ensure that we can pass this communication across to stakeholders and decision makers? We also had radio messages, and something that came across very clearly were case studies and testimonies. So those also have an impact in having to see maybe increased funding for MNH and FP when you see from the end users what impact those services have made in their lives. We also did ask, are there any other pieces of evidence that are missing which we can use to strengthen the documentation we have or the advocacy we have? And some of the things that came into mind were obviously getting more recent data. So NDHS 2024 doesn't have all the data points released yet, so they would like to see a lot more of that. We also had people giving us feedback on they would like to see more logistics data represented. They wanted to see percentage of teenage pregnancies since that's now becoming an issue. So those are things we'll be looking at to see how we can use that to strengthen the advocacy messages or briefs that we have. Next slide, I think that's it actually. Yes, thank you very much. Comments and questions.
So thank you very much, Zainab and Adebi. I'll hand over to my co-moderator to introduce the panelists, and then we will start a couple of questions for the panelists to speak to based on their experience. And during this session, I hope you are jotting down your questions because we want to have a robust discussion on the use of data. Nigeria is at the point right now that we have totally embraced data. I mean, it's been a journey, and we are aligning based on SWOP and the health sector reform agenda that we all build consensus on the data sources we want to depend on. So no more argument that is not representative, is representative. So this is a time, you know, to also bring to the fore if there's any gap, because to answer questions on and so what is always and so what is the ROI, result on investment. One of my areas I would love to see, Zainab and Adebi, is to see this computation with Naira beside. Because when we do present this comes, you know, from the ground level. So how much is that in Naira? Then I start scratching my head and say, oh, what is the exchange rate for today? Okay, time, no. So if you are able to, because we budget in Naira, really, and we spend in Naira. So when we are tracking, we should track in Naira. I know we love to use this for global, but in adaptation to be used with our stakeholders, it's good to, and put that caveat there that this Naira, you know, is progressive because of, I mean, it's in tandem with whatever the exchange rate is for the season. Over to my co-moderator.
Okay, so good afternoon all. I want to introduce the panelists that are here. I will start by introducing Dr. Adebi Adesina. He's a senior research scientist with the Guttmax Institute, where he works on needs, cost, and impacts of providing comprehensive sexual reproductive health care as part of the ADITOP project team. Dr. Adesina has over 20 years of experience in generating evidence, developing strategy and investment plan that addresses national, regional, global health priorities across multiple program areas, including comprehensive sexual reproductive health care. He has collaborated with national governments, donor agencies and foundations, and implementing partners on resource mapping and mobilization strategies to fund SRH service delivery, health system strengthening, and other public health priorities. Dr. Adebi Adesina, you're welcome. Then the next, yes. So the next panelist is Dr. Salma Mohammed. Is a dedicated medical doctor who heads the reproductive maternal, newborn, child, adolescent, and elderly health under the Public Health Department in the Ministry of Health, Kaduna State, with a strong commitment to improving health outcomes. Dr. Salima has been instrumental in implementing comprehensive reproductive health programs across the states with expertise in family planning, maternal and child health, among others. Dr. Salma currently collaborates with stakeholders to ensure accessible and equitable health services. She is passionate about empowering individuals and communities, advocates for informed choice and support initiatives that promote reproductive rights and health concerns. Through her work, she strives to enhance the quality of care and foster a healthier future for all. So, Dr. Salma Mohammed, you're welcome. Then the next panelist.
Yarima. Go ahead, time.
Okay,
They're
okay.
giving us short time.
Okay.
So the question.
Okay, so now for the questions. Yeah, for the questions. The first question I want to ask is, I think I will go from, yes. So the first question is, Dr. Yerima, this question goes to you. Did you find the evidence convincing and urgent to make the case for joint investment in family planning and MMH?
No, thank you very much for the question. Well, absolutely, I do find the evidence quite compelling and really useful in convincing or making a case for increased investment in FP and MNH. I think specifically I do like two parts of the evidence, right? The first part is really the compelling nature of how we defined, how the problem was framed, right? So the need is kind of clearly defined. Pregnant women are dying. That is call for action. That's the first. The second is the potential benefit of the investment, which also came across to me as really very compelling. And I like the fact that they broke it into health benefit, and even within the health benefit of the investment, you could clearly see the three scenarios, right? So if you don't do anything, this is the expected outcome. If you invest in FP alone, this is the expected outcome. And if you decide to do a joint investment, maternal mortality reduces by up to 80%, right? So beyond health benefits, they also talked about economic benefit, right? So it's not just about health. If you invest $1 or 1 naira, you get $2 or 2 naira in terms of return on investment. So I think if you sum that up, it gives a compelling case as to why stakeholders should consider investing in not just FP, but FP and MNH from my perspective as a development partner. Thanks.
Okay. So thanks very much. I'll pivot to Dr. Salima. You recall that one of the comments I made after the two presentations was adaptation, all right? It's not for the want of, I know the adding it up earlier series was very important for us, to tailor down on investment case for family planning, which advocates used a lot to even get budget line allocation and all. But with this new evidence, the learnings here, I want your insights on what part of the model of this Adding It Up 2024 would you tailor to address your nuances in Kaduna State, or could we tailor to advance regional disparities? We have regional disparities. And that goes to you, Adebi. I'm thinking forward again that the regional disparities with using our DHS and your sources would also be good, because we like to tailor message to the context. So, Dr. Salima, you can use Kaduna State as a case study here for Northwest. What in this model, what would you like to adapt, to ensure that you move the needle? In the morning, during Dr. Yene's session, we learned that we are making progress, but it's slow, right? So what did you see here, or what would you take away? And I'm happy that the constituencies of Kaduna State is well represented here, so that that message will be amplified. Over to you.
All right. Thank you very much. When I first saw this presentation, I was actually excited, because when I saw the decrease in maternal mortality up to 80% by combining the MNH and the FP, I think we should have thought about this since before, because they work hand in hand, like it's a collaboration between the two. And family planning, when you use family planning, it decreases maternal mortality. In fact, before we were thinking of 30%, but now it can go up to 80%. I think that's a good one.
Yeah.
Okay. And what I'm going to take back is, or to add it up, when you use family planning, it is not only for the cost effects, you can also think of the family side. You know, the mother gets time for her children, she can also invest in herself, you know, better care. The neonatal mortality would decrease under 5 because she has time to take care of the children at home and also improve on herself. So going forward with this model, currently we're just reviewing our maternal mortality, perinatal mortality, under 5 mortality, and we realize that Kaduna State is actually on the high, and family planning is on the low because we're having issues with release and cash backing and all. But I think going forward, I think we'll go for advocacies to improve family planning support to lawmakers, policymakers, and how we can also get other partners to support, because most of our family planning is being driven by partners. But I think we can do better than that. So a take home for me is to improve our maternal and neonatal health innovations and the family planning component so that we can see great reduction from what we have now. Thank you.
Thank you very much. Layering on that, I know you've had several advocacy interventions that's been able to get you budget line and budget release. Could you share a few glimpses on how you have used data and how you will use this adding it up data in such? Because, I mean, with your lofty ideas, if there's no money for you to do it, it won't happen. Yes. So looking forward now into your 2025 expenditure plan and layering on the success you've had before using data, how would you use this data as like a refresher to get that integration that you want to see for the 80% maternal mortality reduction that we've seen now in combining FP and MNH?
Okay, when we look at the family planning uptake from the facilities that give family planning, you see some disparities, especially when it comes to, you know, demand and supply work hand in hand. And most of the time, we have a program that we do demand generation from the facility level, you know, at the local level, community levels. But however, when you come down to the facility level, the supply is actually not so good. Sometimes we have a lot of stockouts, and at times patients have to pay out of pocket, which discourages these patients from coming back to access family planning services. So we work with our logistic management unit, the LMC unit, who do inventories to check facilities and availability of family planning. And then we have support from the partners, like I said, who supply some, not all. And you know, we have like 23 local government areas, but we have a lot of service delivery points where family planning is being given. So we can't cover that. So we need the commitment of the government as well to have that gap being filled. Yes, we have had commitment from the government where we had budget allocation of about 250 million naira for family planning commodities. However, we had release of funds, but then cash backing was a problem because there were no funds to do that. So we're still going for advocacies to the government, the key stakeholders, policymakers, to help us see how we can pull these funds and implement family planning so that we can reduce the great maternal mortality we have. Because unfortunately for us, our maternal mortality has increased, not decreased. Yeah.
So thank you very much. My last question to you. Sorry, I'm asking so many questions. My eye is on the money. Show me the money, and I know where your heart is. And I know you've tried a lot, but you've also faced some challenges, you know. Could you share one? I know there are many challenges. One challenge that you face, one that you can, you know, spotlight here for people to learn about advocating for increased funding I love the word that you said, pulling from here and there. And that's where we are now in Nigeria. In the midst of the fiscal space challenges, what barriers or bottlenecks have you faced in advocating for increased funding and increased cash backing? It's not just increased funding, but increased cash backing.
You know, after you finish the advocacy to the stakeholders and lawmakers, you now have to go to the budget or planning and budget commission for release. Then you now have to go to Ministry of Finance. So now during that process, the lawmakers will say, oh, we have allocated this money. Then you go to planning and budget, they will release the money. Now, the money. So when you go to Ministry of Finance, that's when you start hearing there are payments of salaries. You understand? So yes, we have had that cashback. And you know the current economy of this country as a whole, we are having a poverty surge from what I think we are reaching about 80% right now. And if nothing is done, I think our health indices are going to go very, very poorly. So family planning is very important, and we are going to advocate strongly. We will be following them for that cashback because that's mainly where the main problem is. We get the releases, we get the advocacies done, we get everything, but the release of the money is what the problem is. I think because of conflicting important priorities, yes, and that's what is stopping the release, the cash backing. So
thank you. So the last question to Yerima.
Okay, so Dr. Yerima, I'm now the last question goes to you. What factor in this advocacy and investment case experience have you found to be most successful in getting additional resources? I think you should do that in 2 minutes.
No, thank you very much. To be very honest, getting additional resources, especially from government, it's really something extremely tough, especially with the current fiscal realities, right? It's the same government that is facing a lot of shocks, right? We're talking about climate change. We're talking about the significant negative effect of climate change, flooding, drought, everything. Government is still required to invest significantly there. A lot of momentum from global community invest in climate change. The same government that is battling with insecurity, a lot of investment going into that sector as well. So how do you advocate for government to increase investment to health and specifically to RMNCH or family planning and MNH? I think from my perspective from development partners doing this work for quite a while now, I think there are 2 factors, right? The first factor is really understanding which stakeholder to advocate to, right? Which is very much in line with what the co-panelist mentioned, that you have to be critically clear of what the objective of your advocacy is, right? So are you trying to get government to allocate resources? That are separate people that you need to get to do that, right? That's the Ministry of Health. Are you trying to get the government to release what they've allocated? That's a separate, entirely different set of stakeholders. That's the Ministry of Budget and Planning, right? Are you trying to get the cash backing she's talking about? That's the Finance Ministry, right? So you have to be crystal clear. There are 3 mountains that you have to climb before you can get money, right? So the second point in the second minute is the content of the advocacy, right? So the way you frame both the problem you're trying to solve and the benefit is critically important, right? And I would give you an example. If you're advocating to the Ministry of Finance and telling them your MMR is 512, they cannot reason it, right? So you have to really speak the language they understand. If they tell them that X thousands of pregnant women are dying every day, they can at least connect to that. Lastly is the way you relate or the way you communicate your ask or your prayers. Most often, we kind of communicate our ask in form of spend money or allocate money. But if we begin to frame it in form of investment, don't spend, but invest in it, right? If you're telling a governor or anybody, any policymaker that invest X millions in health or family planning, you're going to get 2 levels of benefits, both health and economic benefits. And you're not spending, you're investing. So the framing matters a lot. Right. Thank you.
So thank you. Thanks, Dr. Oyeni joined us as the discussion went forth. And I'm going to round up the session by asking Dr. Oyeni, referring to your comment in the morning session where you did alluded to integration, which this evidence shows us, and that we need to speed up. So my question is, scaling up, how do you want to unlock domestic resources to align with the scale-up mantra and the urgency that we want to see, as Nigeria in crushing maternal mortality? Are there innovative ways that you have put together to unlock domestic resources? I'm not talking about any aid now. I'm talking about domestic resources, despite all the fiscal challenges we have. Salima had said we can pull here and there. So I want to understand where here and there you are able to pull at the national level for us to be able to scale up that integration you want to see. Thank you, Dr. Oyeni.
Thank you very much. The coordinating minister started this. The first thing is the signing of the compact with the state governor. We're all aware we have this challenge of at the subnational level in terms of independence. Many of our implementation, either you are doing resource mobilization, at the state level, we are not getting what we are supposed to get, even after the NCH might have approved. So with that the coordinating minister have started by signing compact, it will make it very easy to look at inwards, support from the governor on their part, and every other ones within the subnational level. Following that, the swap approach that we are working with that gives us one coordination, one budget, one plan, and one M&E. So that has brought everybody together at all levels of healthcare. So we can see things in one perspective. So that will help to be able to seek resources inwards, because Ministry of Finance is involved, planning, and so on and so forth. They are involved. So we will all see things in one plan and be able to see the direction of government where we are going in terms of resource mobilization. Another thing that is being done, government is doing presently, advocacy. And the advocacy is targeted at the sub-national. We have learned some lessons, serious lessons, in a lot of implementation, where at sub-national, before you implement, it's always good to do an advocacy. And your advocacy must look at all the factors that we can use to bring down maternal, newborn, and child mortality with the advocacy kits. So this needs to go out to the sub-national. Since we are looking at one budget, one plan, one M&E. So everybody and the state governors have signed into it. Yeah. With all this put together, I think with this starting point, we will not have problem putting our resources together to meet our unmet need and be able to relate FP to reduce maternal mortality.
Okay, so thank you very much, Dr. Odiyenuyi. So what we are saying now is you integrate this data, this new data coming up, as justification into swap to release money for this integration.
Yes.
And the compact is the accountability framework where we would follow up with the governors. Dr. Salima, that's your
especially at the
to the Ministry of Finance in your states, refer them to the compact they've signed so that they can give this money out for us to do the great work. Sorry, guys, the data session is interesting, but I have the compre on my neck to round up, but we will take 2 questions. I've negotiated with her that we'll take 2 questions. We can't round up the session without taking questions. So if there's anyone who has comments or questions, especially those who have not spoken since morning. I'm looking at the two hands, and I'm not looking there because I want fresh hands. I'm putting on my equity lens now. Yes, please. Okay. I'll come back to you if there's no other. Okay, one. So one from this side. Mr. Epelesa. Yeah. So yeah.
Yes, sir. Okay.
Thank you.
Okay, thank you
Thank
for
you.
the opportunity.
I think I have the floor.
Who is speaking?
Sorry.
You can speak from.
Okay.
Oh.
Thank you, ma. For want of time, let me not bother about my name. Let me just go straight to the question. In the data for family planning investment, was the data gathered inclusive of persons with disability? Secondly, how can we leverage data to ensure that family planning programs are inclusive of persons with disability, and what specific metrics should be tracked to measure the effectiveness of these programs in meeting the needs of these populations? Thank you.
If you have the data.
I'll answer that question really quickly. Thank you so much. It's an important question, and one of the areas that we try to focus on is on marginalized groups and their access to health. Unfortunately, we do not have access to that level of disaggregated data, but we're hoping that in our work going forward, when we start working at the subnational with the state government in gathering that data, we'll be able to include groups that have been historically marginalized. So that's...
Thank you. Second question, please.
Okay, thank you. My one is that I want to leverage on the issue mentioned by the national as well as from Kaduna, that what are the innovations, that is not only the compact, for the subnational, based on the advocate that how are they going to increase their funding on this family planning. Then the second issue, we at the subnational, we are always looking at national, that they are the one that didn't allow the family planning to take up because of this industrialization of the procurement of this family planning commodities. Thank you.
Thank you very much. I think Dr. Oyeneyi, or I can also chime in on that. I think that issue has been solved by the procurement guidelines for states to step up and do. Based on what you have flagged, federal government has brought in that solution. And the challenge is, how many of the states have actually stepped up to use that document to procure? How many states here? 2 states? Okay, I hear Gombe. Which other state? Kano. And which other state? Bauchi. So, Adamawa. So, you see now, out of 36 plus 1, only 5. I'm hearing Lagos. So, we saw a problem. Government came, FMOH came, stepped up, gave you solution. You are not moving on it. Okay? So, I think we have follow-up conversations.
Yes.
The compre has now mandated me to round up. I want to appreciate everyone for this participatory session. There are more discussions, so pull the panelists and the presenters aside and ask more of the questions. Thank you.
Please, a round of applause
panelists.
for them. Thank
we
you.
will take a photograph before we step down. Thank you.
Thank you so much. Thank you so much, Dr. Moji.